Hello, my name is Paige Bateman and this is the abdominal portion of our health assessment. This is my patient Blake. So the first thing we're going to do is just kind of look at his belly, make sure everything looks nice and symmetrical. So go ahead and lift up your shirt for me. His abdomen is nice and symmetrical. No skin tags, no marks, no scars, no stretch marks, nothing like that. No sort of peristalsis, and the aortic is not pulsating. All right, for this portion, we're going to auscultate all bowel sounds in all 4 quadrants. So I'm just going to listen to them with my stethoscope just to notice for any hyper, hypo, or normal active bowel sounds. Okay, and his bowel sounds sound normal active in all 4 quadrants. All right, for this portion, we're going to listen for any bruits over the aorta, renal, iliac, or femoral arteries. So I'll go on this side over here, and I will quickly listen to him. Put your arms at your side, please. Okay, and I heard no bruits from any of the arteries. All right, next I'm going to listen over his liver and spleen just for any venous hums or any friction rubs. So I'll go on this side again. Put your arms at your side. Okay. No rubs or venous friction on the liver or the spleen. Okay, next I'm going to percuss the liver and the spleen for tympany and any areas of dullness. So I'm going to go around on this side. I'm going to start with his liver and spleen. Okay, so it gets dull right about over here, and the dullness was right about, I'd say about 6 centimeters over from the area where I first heard tympany to the area where I first heard dullness. Okay, next I'm going to assess him for any splenomegaly. So I'm going to go around the lowest axillary space, which is right about here. And I'm going to percuss, and I'm going to actually take a big deep breath in and out. And I didn't notice any signs of splenomegaly with that. All right, next I'm going to palpate the 4 quadrants for any signs of guarding, tenderness, or any masses. So he's got his knees bent, he's in the correct position. Just tell me if you feel any tenderness, okay? Any tenderness there?
No.
Okay, next I'm going to do some deep palpation, so just palpate 2 to 3 centimeters deeper. Just note for any tenderness, okay? Any tenderness here?
No.
Okay, perfect. And he has no tenderness, so we don't have to further assess for peritoneal inflammation because there was no areas of tenderness. All right, next I'm going to palpate the liver edge, the spleen, and the kidneys for any enlargement or tenderness. So I'm going to go around here. We're going to find his 11th and 12th rib, and we're just going to kind of palpate up towards the ceiling. Any tenderness here?
No.
Perfect. And then we're also going to palpate the aorta, which is just right above the umbilicus. Lay back still. And I can feel the aorta pulsating there. I just put my index fingers on both sides of the aorta. All right, so next we're going to try to palpate for the spleen edge. So I'm going to go around here and go on the left side, and I'm going to ask you to take a big deep breath in, and I'm just going to palpate upwards towards the ceiling. Any pain with that? Anything that's keeping you from taking a deep breath? Okay, so he said that there was nothing that inhibited him from taking a deep breath, so I don't notice any spleen tenderness. All right, next we're going to palpate the costovertebral angle for any tenderness. So I'm going to find his last rib and where it meets the spine, and I'm just going to percuss. Just tell me if you feel any tenderness. Any tenderness?
No.
Okay. Any notes? No tenderness. All right, so next we're going to palpate for any ascites. So I'm going to come over on this side. I'm going to find his liver here, and I'm just going to palpate until I feel, or until I hear some dullness, which is like right about here. Okay, now go ahead and flip on your side for me. Perfect. And then I'm just going to palpate again until I get to a place of dullness. Okay. and I don't note any signs of ascites or anything. All right, so next we're just going to assess for signs of appendicitis. So when I was palpating his abdomen, I did palpate around the area that the appendix would be. He didn't know any tenderness with that, so I'm just going to go ahead and have him flex his right hip. Perfect, and then go ahead and flex it back. Okay, any pain or tenderness with that?
No.
Okay, so I don't know any signs of appendicitis. All right, so the last thing we're going to assess for is cholecystitis. So I'm just going to palpate for the Murphy sign. So I'm going to palpate around the liver edge, and I'm going to have him take a big deep breath in. And did you notice any sharp pain or anything that kept you from taking that deep breath?
No.
Okay, so he is negative for cholecystitis. All right, and that concludes our abdominal focus assessment. Thank you for watching.